Today, we will hear from Dr. Natasha Bagdasarian, our Chief Medical Executive for the state of Michigan. She'll be followed by Veronica McNally, who is president of the Franny Strong Foundation and founder of the I Vaccinate campaign. She is also the only voting member from Michigan on the CDC's Advisory Committee on Immunization Practices. And finally, we'll welcome Dr. Matthew Hornick, who's a pediatrician and president of the Michigan chapter of the American Academy of Pediatrics. And he'll share why he and his colleagues are excited to have this vaccine available to offer some protection for their patients and relief to many families who have been eagerly waiting for access to the vaccine for younger children. Just a few housekeeping items before we get started. Please feel free to place any questions in the Q&A feature. We will conclude today's events by answering some of your questions. You can record this event and we will have a recording available on demand after as well. This event is being streamed, but you are allowed to stream it on your pages as well. And at the conclusion of today's event, we will send you all a press release that covers what we are talking about today. And now I will turn things over to Dr. Bagdasarian.
Thank you, Director Hertel. I'm thrilled to be here with you all this morning on the heels of the decision to authorize the Pfizer vaccine for children ages 5 to 11. The approval process for vaccines includes a rigorous review of clinical trials. That process has not changed with COVID-19. Once the FDA reviews the findings of clinical trials and issues a recommendation to authorize a vaccine, the Advisory Committee on Immunization Practices, or ACIP, needs to do their own robust review of the data. ACIP is comprised of medical and public health experts who can impartially review the efficacy and safety of a vaccine. And in fact, people who are employed by a vaccine manufacturer cannot be on the committee. Members use their expertise spanning immunology, pediatrics, nursing, virology, infectious diseases, and preventative medicine to review the data and consider many factors. They look specifically at the safety and effectiveness of a given vaccine. As a board-certified infectious disease physician, the decision to authorize this Pfizer vaccine for 5 to 11-year-olds is another reason for hope. Yesterday's decision will help move us forward towards safer classrooms, family gatherings, participation in sports, celebrations, and all kinds of other milestones. While most children with COVID-19 have mild symptoms, and some have no symptoms at all, there is no way to know how severe an individual case will be. And we've seen many severe cases and hospitalizations in younger people. That risk is particularly true for children with underlying conditions such as asthma. The vaccine is more than 90% effective at protecting children from serious illness or hospitalization, similar to the level of protection it provides in adults. The Pfizer vaccine for children is administered as a series of 2 doses, 21 days apart, at 1/3 the amount of the adult-sized dose. When your child gets vaccinated, know that they may have some of the same mild symptoms common in adults, such as pain at the injection site, fatigue, and fever. But these symptoms should resolve in 24 to 48 hours, and they're mild when compared to the potential effects of COVID-19 infection. For parents, if you still have questions about the vaccine, that's okay. I encourage you to speak to your child's healthcare provider about the vaccine. And if you've received the vaccine yourself, talk to your friends and family members about your experience and why you chose to get vaccinated. Every conversation you have could save a life. You can also visit ivaccinate.org or websites for the Michigan Department of Health and Human Services and the CDC, and then schedule that appointment. As far as timing, providers have already been receiving the pre-ordered vaccine and can start immunizing the 5 to 11 age group today. Many local health departments are also working with school districts and other community organizations to administer vaccines to eligible children. Minors age 5 to 17 need a parent or legal guardian to provide written consent for COVID-19 vaccination. And COVID-19 vaccines are available for everyone at no cost, including the Pfizer vaccine for children ages 5 through 11. Vaccines will continue to be available to all people living in the United States, regardless of health insurance or immigration status. If enough people get vaccinated, it puts us all closer to the activities, people, and places we've missed this past year, and that normal that we're so looking forward to. Let's come together to get there. Thank you so much. And with that, I'll turn it over to Veronica McNally.
Good morning. My name is Veronica McNally, and I'm the founder of the I Vaccinate campaign. I Vaccinate is dedicated to providing parents with credible scientific information about vaccines and vaccine preventable diseases. I began this advocacy effort because I lost my infant daughter, Francesca Marie, to pertussis, a vaccine-preventable disease. I'm here today to add my voice to encourage parents to get their children vaccinated against COVID-19. And I thought it might be helpful if I talk to you about two specific issues. First, I'll provide some background information about COVID-19 in this age group. And second, I'll provide some information about the vaccine itself. There is significant disease burden in this age group. More than 1.9 million cases have been reported among children ages 5 to 11, with approximately 8,300 children hospitalized to date. About 1/3 of these hospitalized children required treatment in the intensive care unit. Weekly COVID-19 associated hospitalization rates among children and adolescents rose nearly fivefold during June to mid-August of 2021, coinciding with the rapid spread of the highly contagious Delta variant. In Michigan, more than 196,000 confirmed cases from ages 0 to 19 have been reported, and 22 deaths have been reported in ages 10 to 19 as of October 28th. Now, you've heard a little bit about MIS-C. MIS-C is an inflammatory syndrome in children associated with COVID-19. As of October 4, 5,217 MIS-C cases have been reported to national surveillance. And in Michigan, there have been 172 confirmed cases of MIS-C in children younger than 20. MIS-C has been found to be most frequent in children 5 to 11. When I think about MIS-C as a parent, I find it a bit nerve-wracking because it appears 2 to 4 weeks after the onset of COVID-19, and you may not have even known that your child had COVID-19. And substantial numbers of MIS-C patients have had severe complications, including cardiac dysfunction, shock, myocarditis, aneurysm, and acute kidney injury. And many patients with MIS-C are admitted to the intensive care unit. Next, the data is showing that children may contribute to transmission. Outbreak investigations have demonstrated that children can efficiently transmit COVID-19, including transmission to their friends and classmates, their older household members, and community members. And finally, younger children represent an increasing proportion of recent COVID-19 cases, especially since August of 2019. Children 5 to 11 account for approximately 10% of COVID cases in the US overall as of October. I want to talk to you about the vaccine now. The Pfizer-BioNTech COVID-19 vaccine for children ages 5 through 11 is administered in a series of 2 doses, 21 days apart, at 1/3 the dose of the adult-sized dosage. Clinical trial participants demonstrated a strong immune response 1 month after the second dose. Clinical trials have shown that the vaccine is more than 90% effective in children, in preventing children from illness, serious illness, or hospitalization. And this is similar to the level of protection in adults. I want to spend just a minute talking about the ongoing and intensive safety monitoring for COVID-19 vaccines in the United States. There are a number of different systems that work together to rapidly detect rare adverse events following vaccination, and they quickly assess any safety signals. These systems include vSafe, a smartphone-based active system where parents can enroll their younger children and adolescents. VAERS, the vaccines and the Vaccine Safety Data Link, which has 9 participating integrated healthcare organizations and data on over 12 million persons per year. Finally, there's the Clinical Immunization Safety Assessment Project. In closing, I would echo the sentiment that vaccinating younger children will bring peace of mind to many parents navigating this school and return to pre-pandemic activities for their kids. I know parents want to make the right choice for their children and protect them, but vaccination is not just a personal choice. Your decision affects the health of all children in your community, including your own. Survey data indicates that a majority or near majority, that's 46 to 60% of parents, plan to vaccinate their children against COVID-19, and I am one of them. I will vaccinate my child in this age group against this disease, and I have vaccinated my older children against this disease because the data continues to show that the vaccine is safe and effective, and it's been given to 247 million. Doses have been given to 247 million people aged 12 and older already. So I will do this to protect my children and yours. If you have questions, let us help you get answers. Visit us at ivaccinate.org. Now I'd like to introduce Dr. Matthew Hornick. Thank you.
Thank you, Veronica, and thank you, Director Hertel, for having me here today. My name is Matthew Hornick. I'm a board-certified practicing pediatrician and president of the Michigan chapter of the American Academy of Pediatrics. I'm here today to talk about what we as pediatricians are seeing as far as COVID's impact on younger children. The number of children in Michigan infected and ill with COVID-19 and other respiratory viruses is dramatically increasing. Our clinics, emergency departments, and hospitals are all reaching capacity. More than 450 children under the age of 12 become infected with COVID-19 each day. With more confirmed cases, we are seeing more children seeking care for COVID-19 symptoms, and more children are being hospitalized because of that. Higher rates of children being admitted to the intensive care units since last month as well. When combined with the extremely high rates of RSV we've seen since the summer started, more children are seeking care in the ER with mental and behavioral health issues. The number of children needing care is surpassing our state's staffing and resource capacities and straining our healthcare workforce at unprecedented levels. As Veronica mentioned earlier, in the US, more than 1.9 million cases have been reported among children ages 5 to 11, with approximately 8,300 children hospitalized to date. About 1/3 of these hospitalized children require treatment in the ICU. Respiratory diseases can be particularly dangerous in children, and anytime children are being hospitalized, this is extremely concerning to us as pediatricians and something that we definitely try not to do if we don't have to. Another startling statistic is that COVID-19 is now the 6th leading cause of death in children. Our goal for our patients is to promote health and do what we can to prevent infection and illness. And we know what has worked for decades and continues to work, and that's vaccines. Yesterday's decision by the CDC is a huge step towards keeping Michigan's children safe from COVID-19, with 825,000 children now eligible for protection the vaccine offers. The FDA has properly studied the safety and efficacy of the vaccine in this age cohort, and the results are very clear. The benefits of the vaccine greatly outweigh the risks. Getting vaccinated for COVID-19 as soon as possible if you're eligible, and make sure your family's up to date on all their other vaccines, including your annual flu shots. The vaccine is safe, effective, and the best way to keep our children healthy and in the classroom this year. Now I'll turn things back over to Director Hertel for any questions.
Thank you so much, Dr. Hornick, Ms. McNally, and Dr. Bagdasarian. We really appreciate your time this morning and all of that information. We will now open things up for questions. So if you'd like to type your question in the Q&A or in the chat, or let Ms. Poole know if you'd like to ask your question live, and she can unmute you. And I think I will turn it over to you, Andy.
Hi, everyone. At this point, I don't see any questions. If anyone wants to raise their hand in using the raise hand function in Zoom, we did get a question here. Can you address parents who have expressed concerns about long-term effects of the vaccine or severe side effects of the vaccine? Dr. Bagdasarian, I think I'm going to turn that over to you.
What I can tell you is that in the clinical trials in the 5 to 11-year-old age group, the side effects were very mild. And while we don't have long-term data on the vaccines and any potential long-term consequences, we also don't have long-term data on the consequences of COVID-19 infection long-term. The virus simply has not been around long enough, nor have the vaccines. But we have given these vaccines to millions of individuals. And we can tell you that based on giving the vaccine to millions and millions of individuals, we have not seen the types of negative consequences that we do see with COVID-19 viral infection. And so when you weigh the risks and benefits, the risks of vaccination are significantly less than the risks of having an infection.
Thank you very much. We have an additional question here. What is the expectation for the number of children who will get the vaccine out of 800,000 or more? And then what do you think is a realistic number? Dr. Bagdasarian, I'll turn that one over to you as well.
Well, while we don't have a crystal ball to be able to say what we think is going to happen in this age group, we can look at what has happened in the 12 to 15-year-old age group. And what we've seen in that age group is it's just hovering above 40% in terms of vaccine initiation. When we look at older age groups, for example, over 65, we're seeing 85% vaccine uptake. So we are seeing more vaccine hesitancy with younger individuals. However, all we can do to combat this is have conversations like this, to continue having dialogue, to continue talking about the vaccines, talk to your pediatricians, your family physicians, if you're concerned about giving your child a vaccine. And one of the other things I'd like to point to is that in having conversations with my medical colleagues, the vast majority of physicians are planning to vaccinate our own children. I'm planning to vaccinate my son as soon as I can. And I think that speaks to the safety and efficacy of these vaccines.
Dr. Hornick, do you want to add anything on about what you're hearing from your patients?
Yeah, I would echo Dr. Bagdasarian. Most colleagues that I've talked to are planning on vaccinating their kids as well. And I would agree that if we are doing it to our own kids, then we definitely think it's safe. Do we know everything? Do we have a crystal ball? No. But looking at the data that's been out so far and knowing what's happened with other past inactivated vaccines in the history of making vaccines, there's no reason to think necessarily that there's going to be any issues going forward. And in fact, I think, the virus itself is more of an unknown than the vaccine. We have the data on the vaccine. We have hundreds of millions of people that have gotten the vaccine. But this rapidly changing virus is the one that's a little bit more unknown.
Thank you so much. We have a few more questions coming in. Somebody said, I've had a number of parents ask if children should get vaccinated if they've already tested positive for COVID-19. What's the recommendation for children ages 5 to 11 who have previously been infected, and why? Dr. Bagdasarian or Dr. Hornick, can you speak to that?
Sure, happy to take that first, and then I'll hand over to Dr. Hornick for additional thoughts. The recommendation is that even for those who've tested positive previously, we still recommend vaccination. And it's simply because we don't know enough about natural immunity. We don't know how long it lasts or how protective it is as compared to the data we have on the vaccines, where we really understand how the vaccines work and how long protection is offered. We wouldn't recommend vaccinating anyone who has active infection, but once they have recovered and they're asymptomatic, they may definitely proceed for vaccination.
Great, thank you. Another question here. Can you also address how soon parents can expect to be able to make appointments in their community, either at their pediatrician or community clinics? And have the first shipments already been received in Michigan? And if so, how many doses did they contain? Dr. Bagdasarian, or I guess Dr. Hertel or Director Hertel, I'm not sure which one of you would like to take that one.
We expect that any provider who has the vaccine will start taking appointments. I know many places started as early as this morning or last night. We do have the vaccine shipped into the state, just under 300,000 doses. So we would encourage people to call their providers or their local pharmacies to make an appointment. You can also go to vaccinefinder.org to identify a location near you to be able to make an appointment for your children.
Thank you. Another question, of the 287,000 vaccines that were ordered by the state, how many were ordered by local health departments in contrast to pediatricians' offices, health centers, or hospitals, for example?
I don't
Patel.
have that breakdown, but we can certainly get that.
Okay, great. That question was asked by Robin Erb. Robin will follow up with you on that. Thank you for your question. Another question here: how quickly and where can people get the vaccine for kids? Are there kid-friendly locations? I believe that we answered that one already. And then how will this help schools? And could we be seeing outbreaks in 2022? Director Hertel, could you speak to that?
I will very briefly, but I'll turn it over to Dr. Bagdasarian to give a little bit more context. We certainly believe in that once children are able to be vaccinated, we will be mitigating transmission in locations that children gather, like schools. That's why it's so important for children to get vaccinated. I do anticipate that we will continue to see outbreaks across the state in schools and other areas as long as COVID exists. But again, getting children vaccinated is so important to mitigating the risk of spreading COVID-19, as well as mitigating the risk of further mutations of the virus, which, as you know, has become concerning over the last years. We've seen the Delta variant become the prominent strain of the virus across the globe. Dr. B, you have anything you'd like to add?
I think that was spot on, Dr. Hertel. I just would like to add keeping in mind some logistics. So number one, not all children will get vaccinated today. They have to receive 2 doses of the vaccine to be considered completely protected. So those would be spaced 21 days apart. And then we need to give them some time to actually develop an immune response. So there's a lot of time involved in this to actually develop that immunity in schools. And then on top of that, no vaccine is 100% effective. So while these vaccines are amazing, the technology behind them is absolutely phenomenal, they're not 100% effective in preventing transmission. And so we have to also layer on other mitigation strategies. However, I see schools becoming much safer places once children are vaccinated. Thanks.
Dr. Hornick, did you have something to add as well?
Yeah, I just wanted to, echo and also, say from National AAP's perspective too, although we're starting to vaccinate, it's going to take a while. That not everybody's going to, overnight. It's going to take weeks, months. So continuing all of those mitigation strategies, but also ensuring, an equitable distribution of the vaccine and getting, the vaccines into kids equally throughout the state. Will also help while we're still trying to, get things under control in school, and also, try to ensure that kids are still staying in school, not having more access, and as we're already seeing increases in mental health issues from kids being out of school this last year. So I think, that's also our goal, from MIAP's standpoint.
Thank you so much. An additional question here: is there any guidance as to whether COVID vaccines for school-age children will become required like other vaccines? Dr. Bagdasarian, can you speak to that?
Sure. Actually, I'd like to, before I answer that question, if I could just address a comment. Oh, sorry.
I think we lost her camera. She's been having some technical difficulties. Director Hertel, would you be able to jump in on that one about required vaccines?
Mm-hmm. At this point, we have not gotten any guidance from the CDC on whether this will become a required vaccine. And as you know, we currently don't have those sort of mandates for children with the COVID vaccine in schools in the state of Michigan.
Great, thank you. I think that is all of the questions that I'm seeing here. I'm looking here to see if there's any other hands raised. We'll give it a second. Oh, Dr. Hornick, would you like to add something?
I was just going to add from the last question, that the MIAP and the National AAP at this time, we need to really think about, not necessarily implementing, a school entry requirement for that vaccine, as long as, we're not going to have any unintended consequences of further increasing the disparities we've already seen during this pandemic. So, there's lots of things going on in the background versus just a straight up, school entry requirement. So there's a lot of work we need to be doing, in Michigan and throughout the country, while this vaccine is also starting to go out to children.
And we have Dr. Bagdasarian back if you want to add.
I'm so sorry about that. I'm having some issues with my camera this morning. One of the questions that I just wanted to address was, we were talking about what will happen with transmission in schools and how this will sort of affect schools' abilities to stay open. One of the most important things about getting kids vaccinated is quarantine. So not only will we prevent kids from getting infected, from transmission, reduce the potential for outbreaks to occur, but also there won't be so many kids quarantining the more we get kids vaccinated, and that means missing less school. So thanks for letting me respond to that. And again, sorry about my camera issues.
Thank you so much.
So I think does that cover all of our questions, aside from the one that we need to get back to Robin on the breakdown of the shipments. So thank you all so much to all of our speakers and for everyone who joined us today. As mentioned earlier, we'll be sharing the press release with you right after. We'll also be sharing a breakdown of the cumulative number of COVID cases in children in each county in Michigan. Just a reminder that we do encourage everyone eligible to get the vaccine to go out and get this very safe and effective vaccine. It is by far our best tool in ending this pandemic. And if you have questions, there are a number of places that you can go to find answers. iVaccinate is a fantastic resource. Michigan.gov/vaccine also has answers to questions. And of course, calling your local pediatrician or provider and having a conversation with them to get any of your questions and concerns addressed is highly encouraged. So thank you very much. I believe that Andy has her phone number and email in the chat, so reach out to her with any other questions. And with that, please have a great day. We're very excited at the department that this day has finally come, and we're really excited that you joined us this morning. Thank you.